We have a nation that now has 1.1 million people we know of living with HIV, but they are living with HIV. They're not dying with HIV.
AIDS is going to lose.
AIDS is going to lose.
AIDS is going to lose.
If it wasn't for Lifelong, I don't think I'd be sitting here talking to you.
Lifelong AIDS Alliance serves all 39 counties across the state of Washington through helping with insurance assistance to keep people on insurance and have access to health care.
They provided health care for my children when I was younger.
We help people here locally with Chicken Soup Brigade, which is a program that provides medical nutrition therapy through meals and grocery bags, and it helps 1,600 people with HIV and or at risk of HIV. We also do medical case management for 1,000 people across King County.
They helped me get in contact with my healthcare providers, which gave me the medicine and the doctors that I have, which saved my life.
We have housing services. We know that if we house someone successfully, there will be 14 fewer new infections made. We have prevention services to prevent people from being infected.
I haven't found anything yet that they couldn't help me with.
Lifelong is the result of 30 years of battling this epidemic.
White women didn't get it, straight women didn't get it, kids weren't going to get it from their moms. Nobody thought that was going to happen. So there wasn't really a lot of resources out there for you until you found Lifelong.
Today it's much better. We have tools to fight. We have people who are dedicated to fight with us. We didn't have that in the early days. There are volunteers, there are staff, there are people living with the virus who we listen to. There are people in communities of faith. There are people in organizations that provide funding. There are people who are just kind and buy food and contribute food to help others.
There's such a strong network of people and a huge community that rallies around supporting people living with the disease now and helping them make their lives better, as well as education and prevention for the future generation.
It makes me feel like a part of something bigger than the human race.
The more than 600,000 people whose lives were lost because of this epidemic in the United States taught us what we needed to learn and know, and the amazing research taught us, and the reaction and responses from the communities taught us how to really prevent the spread of this disease.
Worldwide, we're saving people every day.
We have, sadly, 50,000 or so in the United States people being infected every year. Those people being infected are being detected much, much earlier, which means we can help them get into care and get linked to care and prevent even more infections from happening sooner.
Getting to an AIDS-free generation would involve a lot of education.
Making sure that people are aware of how HIV is spread, how it's transmitted.
Getting tested is just a smart thing to do, and it's the easiest way to make sure that there will be a generation without it here at some point.
AIDS is going to lose in the world, and the reason AIDS is going to lose is because there is collaborative effort of the government, the community, and our public health arms, and international funding.
It's going to lose because there's so many people against it. Nothing can survive with all of us against it.
I've continued volunteering because the work done at Lifelong points toward a really optimistic future that allows me to be enthusiastic and keep coming back because I want to be part of this fight.
AIDS is going to lose because those of us who survived remember. We remember what it was like when our brothers and sisters were dying. That is no longer happening.
I see things so much differently now. I see people differently. Life, everything, it's different.
We've lived through a time when people could get out of their beds and go back to work and or maximize their lives in ways that none of us could think of when AIDS first came around. We're reimagining that again. We're imagining an end to AIDS, and that is something that is viable.
AIDS is going to lose.